Today, BC unveiled its plan to fight the outbreak.
It's a very challenging virus to be able to contain, and we've seen that globally.
So far, the province has 21 confirmed cases, including one patient in intensive care. One case in particular is troubling because so far it can't be traced back to any of the earlier infections. It has officials scrambling, tracking the woman's history, looking for the source.
And that investigation is obviously one that we're watching very carefully, and there's been a lot of detailed disease detective work being done in the last 24 hours.
Across the border in Washington state, 3 new deaths were confirmed, bringing the total to 14. After a staff member tested positive, this university told its 46,000 students and staff to stay home. Classes and exams will now be done remotely. So many people are staying home in Seattle, commute times have been cut in half. In Vancouver, some things are going ahead as 70,000 fans and players from 16 countries converge on BC Place Stadium for the World Rugby Sevens. This ticket reseller says some people are staying away.
It looks like the local numbers are coming. We have no issues there. It's just that a lot of international groups have canceled.
A growing number of events are being put on hold, including a large hospital fundraiser.
We're getting increasing feedback from both guests and volunteers about their concern.
The BC government says it's preparing for things to get worse, setting up a new task force.
We live in an interdependent world, as all of you know, and there are aspects of this that we simply do not and cannot control, and that's why we have to be prepared.
If and only if things get considerably worse, the government could invoke its powers to restrict travel, ensure there's food on store shelves, and reallocate healthcare resources. Greg Rasmussen, CBC News, Vancouver.